We are all aware of the COVID pandemic, which is sweeping the Caribbean and the globe. And many persons are concerned, what does this mean for them? Many persons are anxious about it. So the first thing for us to remember is that most persons, even if you become ill, you are going to recover from COVID. Most persons may have a few symptoms: fever, cough, sore throat, weakness, fatigue, but you're going to recover. It is those persons who are elderly or have comorbid conditions, cardiovascular disease, diabetes, lung disease. These are the persons who are more at risk and more likely to need hospitalization. And unfortunately, some may also die from it. But most persons will recover. Now, persons living with HIV are also concerned, because you may have heard that some persons with reduced immunity, where your body's defenses are not as robust as a person without any infection, but persons with an immune disorder, some persons may be more at risk, just like a person with a comorbid condition like diabetes. However, so far we have not seen evidence that persons living with HIV and persons who take their medication and are virally suppressed, we are not seeing those persons living with HIV being more at risk from COVID. However, if someone living with HIV is not taking their medication and is not virally suppressed, you need to check your doctor immediately and ensure that you get on your medication and bring your immune status up and improve it so that you are not at risk. Persons living with HIV, like everyone else, need to practice the basic measures to prevent ourselves from becoming infected with COVID. So we must practice physical distancing, meaning that you stay preferably 6 feet away from someone else when you're in public. If you can't manage 6 feet, then 3 feet distance, so that you avoid close contact, you avoid crowds. You make sure that you wash your hands regularly. You travel with your sanitizer, because sometimes you're not able to wash your hands, but you can sanitize with 70% alcohol or a sanitizer, and you keep sanitizing those hands. You also, if you have to travel in public transport, or you're in a situation where it's a bit crowded, put on a mask. You can put on a cloth mask, and this will help to protect you. If you have respiratory symptoms, a cough, cold, fever, it does not necessarily mean that you have COVID. You may simply have the common cold or a respiratory infection due to one of the other viruses, like influenza virus. In those situations, you must wear a mask. Be sure to wear a mask at home, or if others are living with you, or once you go in public. And then we have to be careful, all of us, if we're going to cough or sneeze, we do so like this, or into a tissue and dispose of it, and then you wash your hands immediately. So the precautions that a person living with HIV takes is the precautions that everyone must take. Good hygiene, physical distancing, wear a mask where indicated. For those of us who have been around a while, when HIV and AIDS first came to Jamaica and the Caribbean in the early 1980s, then something that concerned us then is concerning us now. In the early days of the HIV epidemic, stigma and discrimination against persons living with HIV was a major problem. Unfortunately, we still have discrimination against persons living with HIV, but it's not of the kind of proportion and dimension that it used to be. And with COVID, which is a new infectious disease that spreads readily, we are seeing, unfortunately, persons who are suspected of being infected being discriminated against. This is irrational and it is not going to help. If we see a neighbor, if we see the health team coming to visit a neighbor, we cannot be discriminating against that neighbor. It may simply be someone who may have been exposed to a person who has been identified as having COVID, and the health providers are alerting them to self-quarantine, stay at home for 14 days to make sure that they do not develop the symptoms and spread it. This could happen to any of us. So there's no basis for discriminating against a neighbor or someone else who we think may have COVID. What this does is makes persons who suspect they may have the symptoms, the respiratory symptoms, the cough, the fever, the malaise, it makes them fearful of reporting to the authorities, phoning the Ministry of Health and reporting. It drives them underground, and this puts more persons at risk. So this is one thing we must avoid. We should be offering social support and solidarity for persons who may feel they have respiratory symptoms, may or may not have COVID, and especially for the elderly and vulnerable who need our help and support at this time. It is encouraging that governments across the Caribbean have been proactive in responding to the COVID epidemic. All the governments have taken measures to educate the public, to alert us to how we can protect ourselves with physical distancing, with hygiene, with sanitizer, wearing of masks, avoiding public places which are crowded. And the governments have also, of course, locked down the boundaries, reduced travel in an effort to slow the epidemic of COVID throughout the Caribbean. These are important measures. Of course, they have consequences because it affects our normal way of life. We have to stay indoors much more than we're accustomed to, and there is an economic cost. But it slows down the epidemic and allows the governments to better prepare the hospital and health services for when there is a surge in the cases and the frontline health providers have to deal with many sick persons coming to hospital. So we must prepare ourselves mentally during this period and find ways of staying in touch socially through social media, through the telephone, through the internet, supporting one another and finding ways of staying physically active despite our limited movement. And we must bear in mind that there is no short way out of this epidemic. We're going to be facing this for a few months. The governments may open up at a certain point, but we're going to have to monitor very, very closely because we do not want a situation where the health services are overwhelmed with persons who are sick and we cannot provide for them properly. But this is a time to stay calm. Persons living with HIV, remember to take your medication every day, because once you do that, then it means your immune system is fully robust, and just follow the measures that we all know. Hygiene, physical distancing, sanitizing, wearing of masks where needed.